Hello, everybody. This is Dr. Kashif Abdullah. I'm a physician here in San Jose, California, and I'm doing these daily chats about or blogs about coronavirus and other topics. Um, and let's see, I am. If you want, you can ask any question on YouTube. I'll just start off. Hello, everyone. Hello, everyone. Okay, and I guess what I wanted to do was I wanted to improve the presentation slightly. So I'm going to bear with me just a couple of seconds. All right, let's try this. I may have screwed up slightly. Let's see if this works now. So, so let's see now. I'm sorry. Apparently there was no volume. That was my mistake. Just sort of on the fly. So I think there should be volume now. Let me double check here. Is let's see. Let's see. I'm just verifying. I think there is now. Let's see. Okay. So again, what is the difference between a cold, cough, and pneumonia? So I'm sorry I cut off there. So a cold is basically it comes out. Okay. So a cold basically comes in from inhaled organisms and pollutants. And what happens is both cold flu and pneumonia, the globulate cells within your mucosa, nasal mucosa, um, secrete mucus, and the cilia cells can't get the mucus out. That's why you get that congestion. And in colder, drier winter months, this mucus layer becomes too thick and to easily move out the cilia. So the cilium is not able to get the mucus out, and you sort of get an infection. That's why usually in winter we get colds. So again, colds start off as viruses. Oops, sorry, I don't want that. Oh my goodness. They start off as viruses, and you get them by touching contaminated objects and by touching your eyes, ears, nose, and throat. And there's three types for flu, and I'll go into that. But anyway, a cold begins after 1 to 2 days of viral contact. So you touch something, you touched your nose, and it infects your nasal mucosa. You begin with a scratchy, tickling, or soreness of the throat. And then you then begin to have, after a couple of days, the third day or so, you start having nasal symptoms. So you'll start having nasal symptoms, and the sore throat goes away. And first, lots of thin discharge, then it becomes thick, and the nose is then blocked. And then by the fifth day, coughing begins, and then it takes a couple of days to get better. That's usually a cold. So scratching, sore throat, nasal symptoms that first start off with thin discharge of the nasal discharge of the nose, and then it gets thicker and it gets blocked. Your nasal passages, or the what's it called again? The sinuses get filled, and you have this stuffy feeling. And by the fifth day, coughing then begins, and then after that, it takes a couple of days to get better. Now, where is coronavirus in all this? Um, Before I get to influenza, because coronavirus is literally right next to, is basically right there. Because coronavirus and the common cold are essentially basically the same almost, but cousins, but it's more dangerous. And I'll actually go on about why and how it's so dangerous. So the coronavirus can actually come out, will be sort of like this, with a dry, itchy, sore throat with nasal symptoms. So this basically can be essentially coronaviruses, exactly what coronavirus will be like. But after the coughing begins the fifth day, this part, then a couple of days you get better. That's the part that is different. That's the part where you then can fall into pneumonia right here. So common cold doesn't go to pneumonia. Um, but let me talk now about influenza. So the flu is usually more abrupt. This takes days. You said it takes 1 to 2 days. It takes 5 days for all this stuff to happen. The flu, it just happens instant. It can happen in less, like in a day. So literally, in the morning you're feeling fine, and by you're ill by the afternoon. Sore throat and watery discharge again happen, but the discharge doesn't become thick. You have headaches and fevers, highs of 106 as possible, for more than, and it's more severe than the cold. And the greatest difference between the two of influenza and the common cold is you feel tired and you've got muscle aches. That's the biggest difference between the flu. That's why people just are knocked out, and sometimes just they just can't go to work. They just feel sore. They're just feeling horrible. It's the tiredness and the pain in the muscles that it differentiate flu from cold, and also the time. Now, the flu has three virus types, A, B, and C, and we vaccinate against this. You can't vaccinate against the common cold. You can vaccinate against the flu, and that's why we get those vaccines. Now, if the flu goes on, then pneumonia is the next thing that happens, and that's sort of where, again, coronavirus, common cold happened. So pneumonia. So in pneumonia, breathing is very hard. There's shortness of breath, quick breathing. You may have, this is doesn't this sounds familiar to the coronavirus. And bacterial pneumonia may have shaking, chills, high fevers, sweats, coughs, and green and yellow mucus. And this is what we give antibiotics for. So what is the best way to avoid? The same thing that we've been talking about, just for in general, vaccination, but that's for flu. You can't vaccinate for the common cold, and we don't have a vaccine for coronavirus. Frequent hand washing. I wrote this PowerPoint literally 4 years ago, maybe 3 years ago. I'm not sure, but it's the exact same thing. Look, frequent hand washing, and avoid touching your eyes, nose, and throat. Stop smoking if you smoke, or sneezing into tissues or arm folds at elbow, and staying away from sick people who are sick. So literally, what I wrote 3, 4 years ago is what we're doing. Social distancing. See, stay away from sick people. Again, I wrote this 3 years ago, 4 years ago. Social distancing, um, sneezing into your elbows or arms. You've already heard about this. And frequent hand washing, avoid touching, all the various caveats of the common cold we are using, but we're just really ramping up all these things. And then, of course, treatment would be resting for the common cold or even for influenza, drinking lots of fluid, and fever reduction medication, which is just Tylenol. Um, so that's basically a thumbnail sketch of cold, flu, and pneumonia. And so I want to then proceed to talk to you about this is a great website on YouTube about what is happening in regards to the coronavirus. So If you see here, this should be a real-time video. There it goes. There it goes. So if you see here, you'll notice the total number of cases of 521,000 cases, and the total number of deaths. You know, yesterday or 2 days ago, it was, I remember it was like 18,000 2 days ago, and then yesterday was 20,000 deaths, and now it's 23,000 deaths. And this is the whole world. And I remember it was like 420 some odd thousand deaths, cases 2 days ago. Today, 5,200. That's a dramatic increase. And this shows you just these are active cases happening right now. It's in real time. It's on YouTube. I'll show you the YouTube link if I can here. I just put in um, just Corona pandemic real-time counter world map news. So, and then you can see people talking and what have you. But this is a real-time video. Then here's another one, another website I want to share with everybody. And this is basically and also basically a lot of this data that's coming from this is coming from here. So here you'll see coronavirus is 520,000. This one was showing what, 521. So this is a little bit more up to date than this one. But it shows you some really good graphs, and I've got some other graphs I want to show you. But you can see in the world, the total number of cases are still skyrocketing, right? And the number of deaths are also exponentially rising, which is not good, of course. We're still about, it looks like 16% of this in those who have closed cases, meaning those which had an outcome. 16% of people had deaths. So that's really severe if it's 16%. Meaning these are, so I don't know if there's going to be 16% of these people, these cases will recover deaths, but of the closed cases, meaning either recovered or death, there's 16% of the closed cases. So that's very dangerous. This is why social distancing and all the measures that we're taking around the world is so serious. 16% is huge. That's craziness. So in the United States, you can see that, sorry, let me go to the beginning. Again, there is, so here, according to this website, 29,000. If you go to the live one, what they're showing the US is, again, 79,000, about the same. So that's about 79,000, and there's been 1,143 deaths. If you go to the real-time counter, it shows 1,039 deaths. So pretty close. You know, a little bit, numbers a little bit off, barely though. And if you go down to the chart, total number of cases you will see are increasing still exponentially, and the daily cases are still rising exponentially. So that's daily cases. And then here is the active cases, and the total number of deaths in the United States, unfortunately, are exponentially rising. That's not good when they're exponentially rising like that. We want to see this down. People are asking us, when is this going to get better? Trump said that, oh, I want to do maybe, I don't know what he's maybe wavering on that too, but he wants to start opening the country up by Easter. I doubt it. That's going to be craziness. If you open it by Easter, that's not a good idea. If you open the country by Easter, we're not even dropping. I doubt we're going to be. I hope we start plateauing by Easter, but opening the country then is not a good idea. Like stopping social distancing, and then again new death rates, and then here's another one. This one actually I wanted to see. I'm actually Canadian, so I'm comparing the Canadian view, and so their population is much less than the U.S. The U.S. is like 300 million. Canada only has like 36 million. So they have the same rates, 16%. So if you look at them, they're pretty close to the U.S. So the U.S. was what? This is how dangerous this is. The U.S. I'm not sure why it's not showing the U.S. But if you compare this one, it's pretty close to the world. The Canadian outcome. So this, I would then say, then this is pretty accurate. That's why this is so dangerous. And so there's another level of cases. But I did want to show one thing about Canada that's a little bit different in America. You'll notice the total number of cases are dropping. So the Canadians, with their stringent controls, are actually maybe beginning to turn the tide. So you can see the active cases are no longer exponential. There's a slight drop. I don't know how long. Maybe this is true. I don't know. But I wanted to show you another one by Johns Hopkins, actually. Where's Johns Hopkins? Is this the John Hopkins one? So this is the John Hopkins one. This is a great website from John Hopkins that shows everything. Like, so if we take the U.S., it'll show the number of deaths, or actually cases, and you'll see that there is still an exponential rise. But if you compare the other countries, Spain, you'll see, shows still an exponential rise. Iran shows, well, not an exponential rise, but increasing linearly. France, or France, is going increase almost exponential. The UK, still almost exponential. If we go back to the Austria, you'll notice is actually controlling it. You see that there's beginning to dip. The daily increase is falling. So the Austrians are actually doing something really good. They're controlling their cases. They're doing what should be done. The Belgians, same thing. They're slightly, the Austrians are doing better. The Canadians are next. Let's see what they're doing. So the Canadians, like the Austrians, are beginning to control their cases. It is no longer exponential. There is what's called an inflection point. It's changing. You'll see the daily increases dropping for the Canadians. So I don't know if this is a blip. We would have to see more cases to see if maybe Canada has controlled the coronavirus outbreak. Maybe, I don't know. Portugal. I didn't want so South Korea. The South Koreans are actually really controlling it. You see that? They're really controlling. And then China. I want to show you China too. They're showing um, actually. If I can. There we go. They're showing still an increase. But what's interesting is. Oh no, that's not China. I'm sorry. That is the world. I'm sorry. I'm wrong. Where's China? The Chinese, according to, why is this not showing? Is it still China? Because I know the Chinese were showing. There it is. There's Chinese. So the Chinese have completely controlled it. I'm a little bit skeptical of this. Maybe they're just really darn good. They had it first, and maybe they really controlled it, but it looks like they've capped out. Um, but so far, it looks like the Chinese and the South Koreans have controlled it, and in the Western countries, Canada and maybe Austria and the other countries. You can look more further, but it's by Johns Hopkins. Um, it's just put in John Hopkins and coronavirus global cases, and this should come up. Um, and then I wanted to speak for the last couple of minutes about ARDS and why this is so lethal. I wanted to show you, and this is just U.S. population. I want to talk to you what in God's name is ARDS. Okay, so in our PowerPoint presentation, you noticed, or you may have noticed, that there was um, from colds, you go influenza, and then pneumonia. So why is it so deadly? Why is it 16%? So this is why. There's something called acute respiratory distress syndrome. What happens is uh, if this is a picture of the lungs, maybe I want to show you better. Maybe this is a better picture. Okay, so in the lungs, we have two lungs and two multiple lobes in those lungs. And those lungs and lobes are made up of what's something called alveoli, a bunch of air sacs that have capillaries surrounding them. And what happens in ARDS is those alveoli, or the air sacs where gas exchange occurs, gets filled with fluid, this thick, sticky fluid. And gas exchange is no longer happens. And why people are dying is they're dying because of what's called um, respiratory failure. They're dying because they cannot oxygenate their blood. through their lungs, and they literally just choke to death essentially, even though their lungs are, they're not working, but there's nothing in their throat. They're just basically drowning in their own fluids. And so the question is, where did this fluid come from? Well, it comes from the body. And let's see, I want to show you an X-ray. This is a normal person's X-ray. If you look, they're nice and clear. I can see the lung fields right through. This is a normal X-ray. There's no fluid at the base of the lungs here. They're nice and sharp. This is what we look at in a chest X-ray. If someone comes in saying, "Doctor, I'm having a really hard time breathing," one of the first things we do in the ER or in the doctor's office is we'll send you for straight for, and we hear something at the lungs. We want to make sure there's no fluid. But this is a normal chest X-ray, nice and clear lungs. Yeah, that's good. But in ARDS, look at that, full. It looks as thick as the muscle right here, the tissue. It's thick. It's just, this is non-functional lung. This is dangerous, deadly actually. We don't want this. This is really scary. And this is the same person. This is not like this is, I can tell you this is the same person through the chest X-ray. I can tell. Anyway, you may notice that that's a breathing tube going up. That's not, you see, no breathing tube here. That's a breathing tube on that chest X-ray right there. So not good. So, what is happening? Why is this happening? And this is gets a little bit complicated here, but essentially what's happening is this: the capillaries, these things here, these, you see these, this network of arteries and veins, these things get leaky, and they get leaky because the um, the white blood cells and the immune system in the lungs. Um, let's see. Sorry, I'm just trying to figure out here something. Okay. These things in the lungs are releasing pro-inflammatory byproducts that cause the lungs to get leaky. And when they get leaky, the fluid from the capillaries, if you look at here, you'll see the capillaries are opening up and they allow fluid to migrate into the lung and into the alveoli, and it gets full of basically phlegm. And the phlegm has to, we have to get rid of this phlegm. And so then we have to put you onto a ventilator in order to try to mitigate this happening. We give you steroids, and oh, and this phlegm gets lots of bacteria, it gets lots of phlegm in it. You get a lot of uh, nasty bacteria, and that's why. So usually, I had a nurse come over. I had a nurse come over. I was speaking to a nurse, and she was mentioning how they have to treat with how we treat, or they treat with IV steroids for the inflammation, and after the IV steroids, we also treat with what's it called again? Antibiotics. We give two kind of powerful IV antibiotics to kill the bacteria that is growing within this nasty phlegm that is just developing. And the hope is, if we can reduce the inflammation, kill the bacteria, slowly by slowly, the good lung, and the good lung that's left over, we support with a ventilator. Um, we use the ventilator to try to prevent this from happening. The IV antibiotics and the IV steroids try to prevent this nasty soup from being getting more and more, and hopefully let the patient eventually get better. And what happens? The lung will reabsorb all of this junk, or you will cough it up, or what have you. But that's the thing. When coronavirus gets to this stage of ARDS, of all this nasty phlegm being produced in the lung, this is why it's deadly. This is why you have to not have, you have to try to prevent this from happening. So again, these are the active cases. I'm going to turn on the volume there. But um, this is a good website on YouTube that's showing the active cases with it throughout the United States and the world. And right now it's showing Italy. And you can see how deadly this is, and how all the various world is trying to deal with this horrible pandemic. And well, hopefully, people are asking me when is this gonna get better? Uh, it's gonna get better. Maybe it depends on every country and how every country is controlling. It's just literally it's controlling it by preventing the spread of it by social distancing, not allowing sick people or carriers from giving it to other people. That's how this is gonna have to be prevented. And right now they're showing China, they have prevented the spread. So the active cases they're showing have diminished significantly, whereas unfortunately in Italy they're still skyrocketing. I don't know if this will be like what happened in the 1918 pandemic of the Spanish flu, where 65 million people died. I hope not. We're only at here 23,000, but that's 23,000 too many, and we're just gonna have to go by day, and you can here see number of cases, confirmed cases, and the most heavily confirmed, it looks like New York, then followed by Washington, and then California is there as well. I'm actually also concerned for Florida and for Louisiana as a ending note. Those states are not properly controlling, and I've actually read reports where Louisiana has the fastest growing rates. They recently had Mardi Gras, and that was a easy way of just spreading the virus all over the place. So, and I don't think those states are actually taking this as seriously as other states are. So, we'll see how things go day by day. If you have any questions, leave those questions in the comments. I try to answer all questions and comments right now. Um, Again, it's a great website, and the John Hopkins website. I'll leave you with that one. That's a really good one. Um, this is a really good website that gives active, confirmed results, and it's updated literally daily. Not daily, but very frequently. Not just daily. But yeah, if you have any questions, thank you again. All right. Bye bye.